Welcome to the Prospective Doctor podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hi, everyone. It's Arkita here with our very special guest, Dr. Ariela Marshall, and we're going to have an excellent episode talking about a lot of interesting topics today. And I'll just let Dr. Marshall tell us a little bit about yourself.
Well, thanks so much for the invitation. I am a hematologist and I practice primarily benign hematology or non-cancer hematology at Mayo Clinic. But my real passion is medical education and career development for our trainees. And so I'm really excited to be talking with you all about career development and education today.
Perfect. I'm super excited to have you here today. You mentioned that you practice hematology. What exactly pushed you to pursue a career in that particular specialty?
That is a great question. So I actually had some experience, even in undergraduate, doing research in hematology and oncology. And during that time, I got to shadow in the clinic, and I had an amazing mentor. And that kind of already gave me an idea going into medical school that was a field I was interested in exploring. And then really throughout medical school and throughout residency, my clinical experiences and the research that I did really made my interest just that much stronger. Specifically when I got to fellowship and had kind of in-depth clinical experiences is when I realized that the benign hematology, specifically thrombosis and hemostasis or clotting and bleeding, which is what I do, appealed to me most. I've always liked inpatient medicine. I've always liked kind of acute conditions. And in thrombosis hemostasis, we see a lot of inpatient consults in terms of patients with acute onset clotting or bleeding, which I really enjoy. You get to make quick decisions and interventions and hopefully help patients on a very short time scale and see the results of your work. And in the outpatient world, I've always had an affinity for women's health. And so I focus a lot of my patient visits on counseling for contraception and childbearing in women who have disorders of thrombosis and hemostasis. So it kind of was a nice way to fuse all of these different interests into a field that really appeals to me.
That's really interesting because you started out in your research even in your early years, and then you discovered that you can merge your inpatient love and your outpatient loves together and do the things that have like the very fast turnaround, and you can see what happens to the patients on the inpatient side, and then you can help impact the care of women as an outpatient. So I think that that's totally cool.
Absolutely. No, I love what I do.
Yeah. You are an associate professor of medicine and an associate program director of Mayo's Hematology Oncology Fellowship. What do you think, from your perspective, since you've seen a lot of trainees come in and out, what do you think makes a good student on the wards?
Yeah, I think people are always interested in this, how can I make myself the best student possible? And everybody that you ask is going to give you a little bit different of an answer. For me, it's about somebody who's showing interest and involvement with their patients and the care that they're providing for their patients. So we often say kind of as you go through medicine, the time that you have to spend with patients decreases. So really our medical students are the ones who have the most time and the most opportunities to really sit down and get to know patients one-on-one. So for me, kind of being the best student possible is really taking that time to sit down with a patient, maybe if they have a family member, to sit down with them and see not only kind of what brings them in, but what are their circumstances, what are their socioeconomic circumstances, what are their demographics, what are kind of social determinants of health that could be impacting their health care beyond just what brings them into the office or the hospital that day. And as a student, you may be the only one who's actually asking those questions and getting that information. And so to be able to give that information to the rest of your team really helps us in terms of decision making and recommendations to involve you and the patient in their care. So I think that interest and that involvement with the patients themselves, and then really just kind of knowing everything about your patient. You don't always have to present all of this information, whether it be on rounds or anywhere else, but having that knowledge in the back of your mind, if it comes up, I think is really important. Doing some reading about your patient's conditions, about how you may treat them. Certainly we're not expecting medical students to have kind of all the answers in terms of when we say, oh, what did you like to do for this patient? The medical planning, that's what you're doing, later on, your training, your residency, your fellowship for. It's what you keep learning as a practicing physician. But that interest, that, drive to know about your patient, I think starts early on. So for me, that's what makes somebody an excellent student.
Absolutely. I couldn't agree more. And I love that you hit on a few points, like students, you have the most time you're ever going to have with a patient. So utilize that time to get to know them and get to know the disease processes that are going on and kind of know them better than anyone else on the team, because you may not realize how valuable you are with certain information. And Dr. Marshall also mentioned thinking about the social determinants of health, which are very important because patients don't always read the textbook. And sometimes the things in their lives, like if they have enough food, if they're able to afford their medicines, if they're homeless, if they're lots of different things, employed, those things may affect their health status. So asking about that and asking why, like patients may be readmitted to the hospital or return to the clinic and not have their disease controlled because they haven't been taking their medicines, and instead of labeling them as non-compliant, figure out why, because there's always a story behind it.
Absolutely. Completely agree.
Yes. And you have a lot of leadership roles. And as we've been discussing here on the podcast, all physicians are leaders, regardless of their titles. How would you suggest that a student work on developing leadership skills?
Another great question. So I think the first part of that is actually seeing oneself as a leader. So it may seem, because medicine is so traditionally kind of hierarchical, that you're the lowest person on the totem pole. So how could you consider yourself a leader? But your patients look up to you. And again, because you're the one spending the most time with them, they will see you as their doctor. And that's a very important bond to have. So even there, you're kind of starting to be a leader in healthcare. And so seeing yourself as a leader, calling yourself a leader, I think is very important to take that first step toward learning to be a better leader. And for me, leadership really is about learning how to listen and respect everybody's point of view and opinion. And that's certainly something you can do as a student, is just asking everybody that you're talking with, whether it be your patients, whether it be your team, tell me more about that. Tell me what your opinion is and why you think that. Somebody who has the ability to see beyond their own thoughts and opinions and respect those of others, even if they may disagree with them, is going to make a great leader and somebody that people will respect over the course of time. And so if you can develop that, what we call kind of EQ, the emotional intelligence, as opposed to the IQ, the intellectual part of it, if you can develop that EQ early on, that's one of the key characteristics that future great leaders have. So I think practicing those interactions, practicing being respectful, but yet, forceful in certain situations is also, very important. Just because you're a student doesn't mean that you can't have an opinion on something and state it and state why you think that's your opinion. And if you feel it's important for the patient's care to really advocate on behalf of the patient. And again, I think that no one would take that advocacy as something wrong. It helps you build those leadership skills. And then again, learning to listen to the other opinions and respect everybody on the team. I think those are easy things to do as a student, but really seeing yourself as a leader from the moment that you step into medical school.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of PreMeds who apply to medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. It's a complicated process, and even students with great grades and MCAT scores get left out. That's why more students than ever are turning to Med School Coach for admissions advising. Our advisors are all physicians and former admissions committee members, so they know exactly what medical schools are looking for. One-on-one admissions advising from Med School Coach makes all the difference. Our expert team will help you develop a game plan, prepare your application, edit your essays, and coach you for interviews. Every pre-med has a story, and we'll help you tell it so you can stand out from the crowd. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach admissions advising package. You can achieve your medical school dreams, and Med School Coach can help.
I couldn't agree more. Emotional intelligence is super important, and it's something that there's discrepancies on whether or not it can actually be taught. I think you can work on it, but it's something that you can take and learn those skills and apply them. And also advocating for your patients is very important, especially in school. As we mentioned, you guys know the most about your patients. You may not necessarily be at the point where you're developing plans for the medical care, but you know a lot about the person. So that's invaluable, and you guys are valuable parts of the team, and you can contribute your leadership in different ways. My next question for you is in regards to personal wellness. You are the Director of Student Wellness and the Co-Chair of Physician Wellness in Hematology. What recommendations do you have for students to prioritize their personal wellness while navigating the journeys through medical culture, where they have a lot of time obligated to lecture or to different coursework or studying for the different steps? How can they prioritize their own wellness?
Sure. And this is definitely a question that we're always trying to answer without a perfect way to do that. There's an innate amount of time and effort that goes into medical school. Everybody is going to have long schedules and be fatigued. So we're not trying to say, oh, you should never feel fatigued as a student. That's different than the concept of overall trying to maximize wellness. I think there is a lot of generational difference here that comes into play. So if you look at who is still primarily leaders kind of in medical education, in the wards in terms of department leadership, these are people who tend to be older in an era where there is less focus on physician wellness, less awareness of the burnout that is so highly prevalent in the physician workforce. And so people who may not know how to prioritize wellness. I think that in our current generations of medical students and trainees, so more of the millennials and the Generation Z, there's a lot more awareness that personal wellness is just as important as education or anything else in one's life, because it really stems from being well at the beginning to be the best possible student or physician that you can be. So I think you do need to be aware that there are some generational differences, and not everybody is going to see wellness as a priority. But that said, I think it is about having the personal strength to step up for your own rights. Somebody asks you to do just one more thing or stay just one more hour, to have that courage to explain. You don't have to just say no and call it end of the day, because that might not go over so well. But having that courage to say, I'm really sorry, I can't attend this meeting. I have an obligation outside the hospital. I have a family obligation. I've, been here for 12 hours and, I need to go spend some time with my loved ones, or just, take a little time for myself. And, again, there's no guarantee that that's going to go over well depending on the person that you're talking to. But I think it's a skill that we need to develop over time. It's like a muscle that you need to strengthen, to have that strength to say no for certain things. Because I can tell you, over the course of your medical career, the amount of demands on you only grows over time. The amount of meeting invites that, maybe off hours, that 6:30 a.m. meeting, that 7:30 p.m. meeting. And at some point, you just have to learn to say no, because it's only going to increase your burnout and take away from your work-life balance. And I think that the earlier you can start realizing what's important to you and being able to say no to those things that aren't directly helpful for your own professional development or aren't directly required as something that's part of your curriculum.
Mm-hmm.
And the earlier you can start practicing saying no to some of those things and feeling comfortable doing it, the better, because then by the time you get to the point in your career when you have to do that more often, you'll be pro at it, whereas some other people just have to start to learn at that point in their career, and it's very uncomfortable.
I love that because I'm not so late, but not so early in my career. I'm about 5 years out of residency. And as you gain more and more responsibilities, when you do great work, people try to put more and ask you to work with them and collaborate. And that's all exciting. But sometimes you have to put yourself first because you can't refill other people's cup until you refill yourself. And it may take courage to say no. And as a student, as Dr. Marshall said, it may be a little more difficult with different grades and different things. But that's why it's important to see what your expectations are in the beginning and seek feedback and see what is expected of you. And then also learning how to set those boundaries because you have to put yourself first sometimes.
Absolutely. And I talk to our fellows a lot about this. And one way I like to think about it is kind of having a little matrix of a 4x4 with how much effort are you going to have to put into something with, versus what's the impact on your career development.
Mm-hmm.
And for those things, that require a lot of effort, but may have a lot of impact on your career, that's something you want to think about. But if something requires quite a bit of time and effort, but is not really going to have much of an impact on your career, those are the things that you need to learn to say no to. For example, people often get asked to participate on committees, and maybe the first, 1 or 2 committees are great,
Mm-hmm.
but by the time you're getting to the 3rd or 4th or 5th, that may be kind of more of a suck on your time, but less of an impact on your career. And that's when you need to step in and say, I'm pretty burdened right now. I have a lot of other commitments. I'm just not going to be able to devote myself to this in addition.
Absolutely. I love those suggestions because whether or not you guys realize it, you guys are valuable parts of the team now, and you will be as you matriculate and go through your journey of medical school. So practicing these skills are very important in setting boundaries. My next question is about the topic that will not seem to end in 2020, COVID-19. So COVID has changed the way that we train physicians. How has this affected the interview process in terms of residency transition for students and for the residents transitioning into fellowship that you work with?
Yeah, so we've definitely seen a big impact of the COVID pandemic kind of on medicine across the board. I think for interviews specifically, whether it's students who are interviewing for residency, residents who are interviewing for fellowship, the biggest change we've seen is an almost complete move to virtual interviews. So no longer going to the campus itself, but doing either one group interview or multiple individual interviews, all by Zoom or other online platforms. On the one hand, I think there are some benefits. Traveling for interviews is very time consuming. It's a huge financial burden on people to have to pay for flights and hotel rooms and all of that. So being able to do this from the comfort of your own home without, the time to travel back and forth, without those expenses, I think may actually help a lot of people. But on the other hand, I think one of the most important things about doing your interviews is seeing who are the people that are there, who are the residents and fellows that are at that program, interacting with them and saying, is this someplace I can see myself? Are these kind of my people?
Mm-hmm.
And that's a lot harder to do over Zoom or other virtual platforms than it is in person. And of course, you can't physically see the place either. So if you're considering a big move across the country to a place of the country that you've never lived before, it's a big decision to make without physically visiting a place.
Yeah.
So I think there's pros and cons, but definitely things have changed. And I do wonder, even once we get a vaccine and once things have calmed down a little bit, I wonder if we've kind of made a permanent change and we'll be doing virtual interviews long term. I doubt it. I think they'll probably go back to some element of in-person interviews, but the virtual platform may stay for some aspects of the interview. So I think that's changed a lot. But that said, the other changes we've seen kind of in the physician workforce in terms of movement to telehealth, I think has actually been really helpful for patients. So especially kind of in more remote areas where patients may not have the time or the resources to get to a physician who's far away, being able to do a visit by phone or video has actually really helped patients and helped patient care. So although telehealth always existed, COVID kind of pushed us to use it more and more. And so I hope that our students today will get experience with telehealth kind of at an earlier age. A lot of us are kind of just learning how to practice telehealth. And I hope that telehealth will become part of medical school curricula so that students can learn to be the best telehealth providers they can, from an early stage in their training.
At Med School Coach, we know that studying for the MCAT exam can be challenging, especially for busy students on the go. That's why our team created MCAT Prep, the only all-encompassing study app built specifically for the MCAT. MCAT Prep by Med School Coach provides student access to extremely high-quality content and a personalized curriculum for free. The app has more than 250 videos, 1,000 flashcards, and 1,000 unique MCAT questions. Plus, MCAT Prep by Med School Coach allows students to create a personalized study schedule and track progress over time. You need every competitive advantage you can get to get into medical school, and now you can put the experts from Med School Coach into your pocket. It's the closest pre-med students can come to a personal tutor without spending a penny. Download MCAT Prep by Med School Coach for free at medschoolcoach.com/MCAT. Or download it directly from the Apple Store or Google Play Store. You can achieve your medical school dreams, and MCAT Prep by Med School Coach can help.
Absolutely. I think you hit some great points. One, we are being adaptable and going with the change, so flexibility is great for these times. So you may have to do virtual visits, and you may have to, in terms of your interviewing, see if someone can give you a virtual tour, or if you can gain some of the contact information from the residents or fellows in the program so you can have a conversation with them on the side, as opposed to some of the residency dinners and things that they would typically do. And then in terms of the actual work and training, telemedicine has a huge highlight on it right now. And personally, I've been working full-time in telemedicine for the past 2 years, and this year has created tremendous change, but I think it is for the better because I didn't have any training in telemedicine in residency or medical school, and I think that it will become an integral part of the new curriculum moving forward. So we can bring those access to those patients who may not have been able to come or have those extra social economic barriers and bring them the care that they need. So it'll be an interesting time to see where we are in the next 5 years. Now, I truly appreciate everything that you've talked about. There were some wonderful topics that we hit on, including how to do well in the wards versus how to take care of yourself and how to advocate for yourself and advocate for your patients, as well as how to adjust in this new virtual world. What is the best piece of advice that you have for both pre-meds who haven't necessarily matriculated or gotten an acceptance yet into medical school and they're in the very beginning stages of their journey, and the medical school listeners now who are in varying stages of their education?
It's a great question, but probably the toughest question you asked me because there's so many things that we could talk about. So, I thought about this a lot, and one thing I'd like to say that I really wish somebody had told me is about specialty choice, about picking kind of what area of medicine that somebody wants to go in. And I think the perception, is that, okay, you'll get into medical school and you'll do all of your rotations and kind of see what you're interested in and what you like. And, there's some people who get in there right away and say, hey, I really like surgery, or I really like pediatrics or psychiatry. And some people who say, well, I don't like, specialty X, Y, and Z. I'd be okay with any of these other specialties. But ultimately, we're told to pick a specialty based on kind of the subject matter and what we like and what we find interesting and what we like to spend our day doing. But what I wish somebody had also told me is it's not just about the subject matter or what you like, it's about how you interact with patients as well. There's a lot of different ways that we interact with patients. There's people who practice primarily in the hospital. There's people who do primarily procedures. There's people who practice primarily outpatient, people who practice in the emergency department. So it's thinking about what kinds of interaction do you like having with people? What ways do you want to interact with your patients? You may have 3 specialties that you find the subject matter interesting, but if one of them's inpatient, one of them's outpatient, and one of them's a procedure-based specialty, thinking about kind of how do you like to interact with people, not just what do you like to talk with them about, but how do you like to interact with them? Are you a person who likes to really get in there and make an intervention and do a procedure? Are you a person who wants kind of a long-term care relationship with your patients? Are you somebody who likes the acute setting or more the chronic setting? So I think those are really important questions to ask. So it's not, yes, it should be about what you're interested in, but also how you're interacting with people. And I think that's very important for specialty choice and for your own kind of satisfaction and your own work-life balance going forward.
I love that. I can't add anything to that. Like it's very cool to have all of these different interests and you'll get to explore most of them throughout your training, but taking that step back and figuring out what makes you happy, what makes you you, and something that you can imagine yourself doing possibly for 30 years is very important.
Exactly.
Well, I really appreciate everything that you share with us and all of your pearls of wisdom. And I'm sure if you ever want to come back, just shoot us a holler. I'm sure the students would love to learn so much more from you, especially about like the wellness and the work-life balance. But I'll just give you an opportunity to tell everyone bye.
Excellent. Well, thank you so much. This is such a great opportunity. I really love talking about all these topics, especially, as you said, kind of career advising and wellness and work-life balance. I'm happy to, come on again in the future, and I really appreciate the opportunity. So thank you so much.
Thank you so much. And for everyone listening, feel free to write us any messages if you have any questions about any other topics you want us to cover in the future. And I'm going to head out for now and see you guys next week. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.